Hello, let's talk about healthcare. We have one of the most expensive healthcare systems in the world. Virtually twice the cost to everybody as the rest of the countries. Our problem is really simple. Our system is a pay for a procedure. We get sick, we go into the hospital or we go to a doctor and we pay for that specific procedure or whatever needed to be done. How do we know the success rate that a hospital has or the effectiveness that a doctor has in the way he treats something? We don't know anything about that. We just go in and take it on face value. We believe doctors are doing their best, and I believe they are doing their best. But the system is broken. There is no system. The system is pay for procedure. It's not a competitive situation. It's not like Dr. A, who's a radiologist and is looking for breast cancer, can compare his results and his effectiveness of reading x-rays compared to the other doctors. They don't have that information. There's no data sharing that goes on. In your business, where you work, I'm just going to guess, but I believe you probably get a profit and loss statement. You get productivity reports, you get sales reports. You know a whole lot about every phase of your business, where you work, your job. Better manager is one that can give specific information to somebody to help them improve their behavior towards goals. Well, in medicine, we don't have that. In medicine, we go to a doctor, we assume he knows what's going on. Now, understand that there's over 30,000 tests and studies going on every year, and you and I both know they read them all so that they know exactly how to treat and what the newest ways to treat a certain illness are. It's totally unfair. Doctors are seeing huge numbers of patients. The medical system needs to change, and somebody came up with a solution, or a solution that I think is the best solution there is. It's George Halverson. He's the CEO and president of Kaiser Permanente. He wrote a few books about it. The one I'd recommend is Healthcare Reform Now. He also wrote a shorter book called Healthcare is Not Going to Reform Itself. So his solution is really simple. We need to change the paradigm. We need to go from doctors doing a procedure to doctors being incentivized to heal a patient. Here's a very good example. Currently, there's over 10,000 billing codes that a doctor has to charge to the insurance company for the procedure he performed. You know how many billing codes there are for they're cured or he's healthy now? None. Now, we're a free market capitalist society. If you're not incentivized to heal somebody, but just to treat them, what's the drive to head towards healing them? Now, there's a natural desire, but think about the instance where a hospital accidentally has staph infection. They can make they make a lot of money on curing and treating that staph infection, even though it was the hospital that gave it to the patient. Wouldn't you like to know which hospitals have problems with staph infection? The situation is this: we need to redo how we do healthcare. None of the politicians are addressing the issue of how we provide healthcare. They're trying to deal with how we pay for healthcare, how we can make insurance more competitive, or vouchers, or whatever. That's not the solution. The solution is let's improve healthcare. Let's make it part of our competitive free market society. Now, it is a rather large project to understand, but here's another fact you need to know. 10% of the people use up almost 80% of the healthcare dollars. Now think about that. 10% spend almost 80% of the healthcare dollars. So if we don't address that 10%, we're never going to solve our healthcare problem. Those people typically are the ones that have coronary artery disease, congestive heart failure, asthma, diabetes, and depression. If we go after those people, all right, we can then work on shrinking the whole cost of healthcare. But we need to make it competitive. And what we need to do that is data. What we need is electronic medical records. That's the ultimate goal. Right now, when you go see a doctor, he writes it on a chart, files it away, it's on a piece of paper, it's in his office. 2 months later, you go see a different doctor for a different issue. He doesn't know anything about that other chart. Now, what you remember, you'll tell him. But if it's a year or two down the road, do you remember what drugs you were given? Do you remember what the specific issues were? I mean, I'd love to tell you I do, but I don't. We need to make it so this doctor puts it into a computer. And this doctor has access to the information that that doctor put into a computer. And if you have to go to the emergency room doctor has access to that information as well. So he knows what drugs you're on. So he can address the issue of drug interactions. There's nearly 750,000 drug interaction problems a year in the hospitals. It's because they don't know what's going on. There's too many doctors treating one patient. We have to get the information out there, and it's only with that sharing of information we can do that. Now, in the short term, there's another solution that Mr. Halverson suggests. That's using the payer information. In other words, you go to the doctor, you then turn it into your insurance company. Well, your insurance company knows all about you. They know what disease you had, they know what drug you were prescribed, and they know that they had to pay for the prescription. So therefore, we could then start the process by going to the payers and requiring them to share that information. Now, we have to build an infrastructure for this. The healthcare problem is not going to be solved in a year. This is going to take a decade. But if we start today to get information and data so we can let doctors compare, let doctors learn what best practices are, let doctors see that the best practice and solution for treating a certain disease is this. Now, they may want to treat it differently. That's their choice. But at least they'll know what the best practices are, and it's easily accessible. So with that, we have to start the process of building the infrastructure to share the information and change from being a pay-for-procedure to being paid for health. When people have diabetes, they need team care. They need somebody to go, are they following all the procedures they need to do to manage their diabetes? It's complicated. How do we reduce the number of asthma patients that have to go into the emergency room for an asthma attack? With team care and being paid for seeing that the patient is managing their asthma correctly, then we can reduce the overall cost. And that's the long-term solution. So please think about that when you hear people talk about all the healthcare issues and how they're going to try and cut or change how we pay for the insurance costs or make it more competitive. I agree. There's some good ideas that we need to allow for insurance to be sold across state lines. But that's not the solution to healthcare. That's skirting the problem. So think about that when you listen to these solutions. And please, do me a favor. Go read one of the books from George Halverson. Thank you.